Welcome to the Over 40 Alpha Podcast with your host, Funk Roberts.
We are live, and welcome to the Over 40 Alpha Podcast. This is episode number 142, and I'm your host, Funk Roberts, former professional athlete, master metabolic trainer, and I'm the world-renowned health and fitness expert for men in their 40s, 50s, 60s, 70s, and beyond. And this podcast is for you. This is where I bring on health experts, fitness experts, and we talk about how to optimize your health. We talk about how to naturally increase your testosterone levels and balance your hormones. We talk about ways to become the man that you're put on this earth to be, to provide, to protect, to procreate. And with all of this amazing information, we also talk about how to take this information and put it to action. And today I'm excited because we have Dr. Morgan Nolte on the podcast to talk about reversing insulin resistance. Did you know that 88% of adults experience some degree of insulin resistance? That's an astounding percentage. 88% have a degree of insulin resistance. Even if you think you're healthy, you may have some degree of insulin resistance. You know what happens when you have insulin resistance and you don't treat it, or you don't live a lifestyle that helps reverse it? Well, that becomes prediabetes. And then that becomes type 2 diabetes. And that becomes losing limbs at some points. And then it becomes an early trip to your coffin, to your grave. And it's reality. And so we need to understand these things. You need to understand these things. I need to understand these things, and how we can live a lifestyle that will help us reverse it. But it's not just about that. Remember, knowledge is power. And the more knowledge we have, the better decisions we're going to make when it comes to our overall health. So Dr. Morgan Nolte is going to talk about ways that we can read our tests that we get. She's going to talk about insulin resistance versus insulin sensitivity, because sometimes those two get thrown interchangeably, and sometimes people don't understand what's the difference. Do I want to be sensitive or do I want to be resistant? I know that when I first started in this health and fitness industry, that was one of those things that I always got wrong. 15, 16 years ago, when I decided, I'm going to do this, right at the beginning, this is something I was like, do I want to be resistant or sensitive? Like, I had to always research before I even talked about it. But today we're gonna uncover what some of the common signs and symptoms of this, why we actually become insulin resistance, and the difference between the three: prediabetes, type 2 diabetes, and insulin resistance. We're going to talk about the A1C and reading all of those tests. We're going to talk about the public fears that people have about eating meat and dietary fats. And we're also going to tackle this cholesterol issue, right? How doctors are rushing to prescribe you statins or prescribe you some type of prescription drug for cholesterol or insulin, or it's not even insulin resistance. It's just, cholesterol, or a marker that they may see that they may not understand either. And so I'm really excited that you're here. I'm really excited for you to dive in, and please take notes, because Dr. Nolte also gives you a ton of resources. She will rhyme off so many books for you to read. And I think it's important for us to take note of these books. So once she gets that book and she talks about, you got to get this book, or you got to listen to this podcast episode. Stop the podcast, write it down, and then continue. This is going to be one of the most important podcast episodes for you. I'm telling you right now, the information here is going to be so valuable and can save your health and save your life. So listen up and enjoy. And before we go, of course, if you do need a program, because one of the great things that Dr. Morgan Nolte and I talked about was how the Over 40 Alpha program, my program, which is for men in their 40s, 50s, 60s, 70s, which is literally the step-by-step blueprint to optimizing your health, losing weight, burning belly fat, building muscle, increasing your strength, increasing your energy, but also naturally increasing your testosterone levels. Literally every single day, somebody is posting in our Facebook Brotherhood group how their testosterone levels have naturally increased, and they continue down that journey using this specific program. But we are both aligned with how to reverse insulin resistance and how this program, my program, the Over 40 Alpha program, which you just go to over40alpha.com and join for $1. Literally, for $1, I'm going to give you 30 days inside the Over 40 Alpha Brotherhood. 30 days. That's one phase. So, because I want to prove to you that in 30 days, I'm going to help you not only improve your health, lose some weight, but you're also going to learn about the right foods to eat and the foods to stay away from. You're going to learn strategies to keep you injury free. You're going to have done for you follow along workouts. Literally, all you have to do, click play, and you and I are going to be trained together. So you have to worry about anything. Just show up and work out. And if you don't have access to dumbbells, because that's what we use in the main workouts, dumbbells and body weight, then we also have a no equipment version as well. So doesn't matter. You can start literally today. And of course, one of the most important aspects of the Over 40 Alpha program, the Over 40 Alpha Brotherhood, is just that, the brotherhood, the support of thousands and thousands of men who are on the exact same journey as you in our Facebook group. But also, I do a live coaching call every single week, 9 a.m. Friday morning, Eastern Standard Time. I'm there and we talk about a specific topic. I answer your questions and I'm there for you. There's no other program on this entire planet, not even close, not even 10% close to what I provide and what we provide in this program. You get access to the Funkster. I will answer your questions, not just on that live, but when you put in hashtag AskFunk inside the Facebook group, I'm going to answer those questions. Not only that, there's no program on this planet that gives you follow along workouts for 3 years. I know. I just said $1 for 1 month, which is where you have to start. Phase 1. Everyone starts there. But imagine having 3 years of programming, follow along workouts that as you get fitter and as you get in better shape, the workouts are going to get a little bit more challenging. But again, these are the workouts that are going to help you progress. These are workouts going to help you with your health, with your hormones, and ensure that, this is a lifestyle that you'll take for you into your 40s, 50s, 60s, 70s, 80s, and beyond. And the proof is in the pudding. If you just go to over40alpha.com/proof, you will see thousands of, or hundreds and hundreds of before and afters, but thousands of testimonials. Listen, guys, there's no other program on the planet that even touches the Over 40 Alpha Brotherhood. Not even touches, not with what you get with this program. Warm-ups, ab and core circuits, stretches, recovery, things that'll help you stay injury-free. Yes, I am tooting my own horn. Toot, toot. Yes, this is the best program on the planet for men over 40. Bar none. I will challenge any single fitness and health person on this planet to step to this program, because you can't. So, over40alpha.com, $1. I'll help you and we will help you get into incredible shape through your 40s, 50s, 60s, 70s, and beyond. And Dr. Morgan Nolte, she's going to help you understand how to reverse insulin resistance. I'm the Funkster, and I'll see you on the other side. Enjoy the podcast. Welcome, everyone, to the Over 40 Alpha podcast. I'm really excited about this episode because, there's one thing about insulin resistance that a lot of us don't really understand. First of all, this is a silent contributor to a host of chronic health conditions. Things like, Alzheimer's and obesity and type 2 diabetes and cardiovascular diseases. And I'm not sure if you knew this, but there's about 88% of adults in the US specifically that have some degree of insulin resistance. And although this condition can be very persuasive, it's easy to miss, specifically because we may be thinking that we're doing everything right and still have some degree of insulin resistance. So I'm really excited today to have Dr. Morgan Nolte, who is a clinical specialist in geriatric physical therapy, to discuss insulin resistance so that we understand what it is, why 88% of us people have it, and what changes we can do in our diet and our lifestyle and our mindset to help reverse this condition. So again, thanks so much for being here, Dr. Nolte. How are you?
I'm great. Thank you so much for having me. This is a fun topic to discuss, and I think it's going to be really valuable for the people listening to your podcast. For sure.
So first, let me ask you, how did you get into focusing on insulin resistance? Because I know that you're you're in geriatric therapy, but I'm not sure if there's a connection.
Yeah,
usually?
that's such a great question. I love starting here. So, as a geriatric physical therapist, I saw firsthand all the chronic disease. I saw, men in their 60s having strokes and then passing away. I saw, men in their 60s, 50s having heart attacks that massively changed the quality of their life. One of my favorite patients was in his 70s with uncontrolled type 2 diabetes. He fell, was on the ground for 3 days until a neighbor found him, spent 9 months in rehab. And so you have to think about that ripple effect on the family, right? And I know so many men who are a burden on their wives, just point blank, because their wives have to manage their medications, set up all their doctor's appointments, be sure they're taking their medications correctly. And so I think for your target market especially, this is really important for them to understand that if you want to be a positive contributor to your family and to your community and not a burden on your family members, getting control of your metabolic health and understanding insulin resistance is really key for that long-term health that we are all after. So I saw it and I was heartbroken. And the more that I researched diabetes and heart disease and dementia, all these things that I was treating in geriatric physical therapy, the more I realized that I wanted to be on the proactive side of things because we were spending so much time, energy, and money reactively treating disease. And I knew if those resources were, redistributed earlier in life, in your 40s and in your 50s, man, you can drastically improve your longevity and your health span and have a better life. And so that's where my passion really is in helping people live this low insulin and low inflammation lifestyle so that they can just have a long, healthy, happy life and not spend the money that they worked super hard to earn on pills and doctor's appointments and surgeries and hospitalizations, because that's happening to men every single day. And we really need to prevent it.
I am so happy that you said a burden on the family, because that is one of the key points that I, use a lot when we talk about men over 40 and our role and how we don't want to be, provide, protect, procreate. But when you're unhealthy, when you're sick, when your wife or family members have to be, okay, you got to take this pill today and this pill today, and you're being a burden, not only financially, but mentally, physically, emotionally on your family. It's unbelievable. So yeah, I'm so happy you said that, because when I'm saying it over and over again, sometimes they say, oh yeah, Funk, yeah, you keep saying it. But when other people come in and chime in for that importance, I love it. So why don't we start by, what is insulin resistance? Because, a lot of people still don't know what it is.
Yeah. So insulin resistance is essentially pre-diabetes. So a lot of people are familiar with prediabetes or type 2 diabetes. We're actually taking it a step back because you can detect insulin resistance through high levels of insulin up to 2 decades before you're going to see a rise in your fasting glucose or your hemoglobin A1C. So that's why this is important. Insulin resistance is when your cells become resistant to the effects of insulin, which is a hormone made by your pancreas. It's vital. We all need insulin. If you don't have any insulin, then you're a type 1 diabetic and you have to inject yourself with insulin to survive. And insulin has 2 primary roles. So the first is blood sugar regulation. We know that healthy blood sugar regulation is so important. High levels of blood sugar are very inflammatory. They cause a lot of oxidative stress. And so we want to keep our blood sugars in a healthy, stable range. And in order to do that, we need healthy insulin sensitivity. We want those cells to be sensitive to insulin. So just a little bit is needed because high levels of insulin are also inflammatory. So the second thing that insulin is responsible for is fat creation and storage. You cannot store fat if your insulin levels are very low. So type 1 diabetes, for example, people that don't make any insulin, that used to be called the wasting disease. And somebody with type 1 diabetes, they don't have any insulin. They can eat and eat and eat and drink and drink and drink and not gain any weight. They're just excreting all of that because insulin serves as a little key to unlock the cell, to let the nutrients into the cell. And so if you don't have the right amount of insulin, then nutrients are not getting into your cells. And that's actually one thing that happens with insulin resistance is your cells have a harder time letting those nutrients in. So like increased carb and sugar cravings is often one kind of symptom of insulin resistance there. So that's insulin resistance in a nutshell. And I think it's easiest to think about it in terms of alcoholic resistance. So for somebody who maybe was buzzed after, 2 shots earlier in life, eventually your cells become resistant to the effects of alcohol and you need more and more and more. And now it takes 5, 6, 8 drinks to get that same buzzed effect. So the same thing happens with your insulin. If your blood glucose levels are constantly high, constantly stimulated, you're going to need a lot of insulin to move that blood sugar into your cells to be used for energy or to be stored for later use. And over time, if your insulin levels are high, you're going to become resistant to the effects of insulin. I always like to say it's like me telling my kids to go put your clothes away, go wash your teeth, like go brush your teeth. They tune me out like the first 2 times. Then I have to get louder and louder so that they pay attention. So that insulin level has to get higher and higher for your cells to pay attention. And again, your doctor is probably not testing your insulin levels. Most are not. And so it's important for you to independently ask for that insulin test, expect resistance from your doctor. Most doctors are going to say things like, well, that's not necessary, you're not diabetic. Or we don't test insulin, we just use hemoglobin A1C. They're simply not educated in the importance of early metabolic testing. Again, that fasting insulin will be predictive of type 2 diabetes up to 2 decades before you see a rise in the glucose or the hemoglobin A1C, because insulin is rising in the background, keeping blood sugars in a healthy range. And that's why a lot of men are like shocked in midlife when all of a sudden they have this A1C of 9 and they're like, well, where did this come from? So I think that's insulin resistance in a nutshell and why it's really important to get a fasting insulin level checked.
Okay, so we're going to break this down a little bit. So we want to be insulin sensitive, right?
Yep.
That's the opposite of insulin resistance. You also said something that's really important that, again, I have to repeat this all the time, is our doctors push back on a lot of tests that we need. For me, because my program helps me naturally increase testosterone, that's one of the tests that I always get these guys to ask for, to request. And there's always pushback. It's like, well, I don't know, my doctor says I don't need it. And you know what I mean? And it's so like, this is the same thing. This is the exact same thing. And the reason why, again, no disrespect to doctors. There's like family doctors, you guys have a lot coming in. You have a lot of patients in and out, and you're the jack of all trades, but not the master of one. And so you have to be proactive, as you said, to ask for these, to push back and continue to push back and demand these type of tests. So again, very happy to hear that. And the other thing that you mentioned about insulin resistance is, so just to give perspective, if you are resistant to insulin, so at first, let's say you're eating carbs, like you're eating a bunch of carbs, and then all of a sudden you still feel full, or you don't feel full actually, and you're just like, oh my God, I need more. And then that's where the cravings come. And next thing you know, you got a bag of chips, or you got cookies, or you got all these other simple carbs, and still not feeling that you're full. That's probably one of the key indicators, perhaps, that you may be insulin resistant.
Perhaps, or just that you're eating too many refined carbohydrates, because those actually stimulate more hunger.
Totally.
So get a fasting insulin test. Ideal is less than 6, but you can ask your doctor. You can go to testing.com, and that's about $30 out of pocket to get it like tested at a Quest or LabCorp near you. And then we sell at-home insulin test kits. So you just prick your finger, put the drop of blood on a piece of paper, and send it into the lab if people want an at-home option. Yeah. So ask your doctor. Testing.com or our at-home option. Those are the 3 I typically recommend. But other symptoms of insulin resistance, like pretty big indicators that you are insulin resistant, would be excess belly fat, high triglycerides, low HDL, high blood pressure. So those are going to be the 4 to 5 main indicators. And of course, high blood sugar. If you're pre-diabetic, if you have type 2 diabetes, you're absolutely insulin resistant.
Okay, so what are the differences between insulin resistance, pre-diabetes, and type 2 diabetes? Because we know that type 1 diabetes, usually if you're type 1 diabetic, you've been type 1 diabetic pretty much since you've been a kid. Like, this is not something that you're going to all of a sudden get, right? Like, this is something that's
Most of
happened
the time. I
most of
have
the
heard
yeah.
of adult onset. Yep.
Okay. But in regards to the three, insulin resistance versus pre-diabetes versus type 2 diabetes, can you give us a difference between the three?
Yeah, I like to think of it as like a train track, and they're all the same. It's just with insulin resistance, and specifically if we're talking about fasting insulin levels, there's no diagnostic cutoff because we've been testing blood sugar, blood glucose a lot longer than we've been able to test insulin. Like, we have continuous glucose monitors, but the technology is not sufficient so that we can have continuous insulin monitors yet. And so that's why it's been around longer. So we have established cutoffs for blood glucose levels. So quote unquote normal is 99 or less, but I really like to say optimal is in the mid 80s to 90 range fasting for your blood sugar. The pre-diabetic cutoff for blood glucose is 100 to 125. And then for type 2 diabetes, if your fasting glucose is 126 or higher, that means that you have type 2 diabetes. And then for your hemoglobin A1C, there's different cutoffs. You can just Google, hemoglobin A1C cutoffs. That's a 3-month estimate of your average blood sugar levels. So insulin is going to be behind the scenes in all of these. I think the best test for that pre-diabetes, like if you have healthy blood sugar levels, you have a good A1C, how to catch insulin resistance is check that fasting insulin, but it's called the Kraft test, K-R-A-F-T, and it's similar to an oral glucose tolerance test, which many people have probably heard of. So what you do is they check your glucose and insulin fasting. Then you take a bunch of sugar in a liquid. That's going to cause a blood sugar spike and a resulting insulin response. And you're measuring the curve of your blood sugar and in the background, that blood insulin at about 30 minutes, 1 hour, 2 hours, 3 hours. And that's really where you're going to see is my blood sugar curve healthy, and in the background is my insulin curve healthy. So the Kraft test, if people want to YouTube, Kraft test or where to get a Kraft test, that would be a really good indicator to see if you have pre-diabetes. It's not like there's again, the American Diabetes Association doesn't have like insulin level cutoffs for pre-diabetes or type 2 diabetes yet.
Okay, so I'm just going to recap.
Yep.
So the score that you're looking at when you're getting the test is 80 to 90 means that things are normal. 80 to 90 is what you want, but under 99 means that you're normal.
Yep.
Things are okay at the moment. But if you're getting between 100 and 125, you're pre-diabetic, and we gotta change things up. And 126 and above, you have type 2 diabetes.
Yeah.
That's correct?
That's correct. I really want to encourage people to know that and to compare that to your own lab results, because recently I was assessing one of our members' lab results, and on the piece of paper, on the blood sugar, it said quote unquote normal was 70 to 126. And so it's very important to recognize that just because you don't have a red flag by your number, I've heard of physicians completely ignoring pre-diabetes for decades, and they just write excellent on the lab work. And that's because the physician is not going to prescribe a medication until you're well into the diabetic range. So they simply, their business model is often not set up to have these proactive lifestyle change conversations with you. Physicians are really unfortunately trained these days to diagnose and prescribe. Yeah. So if it's not time to prescribe, they might kind of glaze over those results. So it's important that people look at their own numbers and not just rely on their physician to tell them when they actually have a problem.
You just said something. You just said 70 to 125?
No, 126 was what they said was the normal range on the lab report.
But you just told me that.
I know. I was like, what is this lab talking about? We're evidently, but that's the thing. we are getting so desensitized to to just health, like I think it's over 7 or near 8 out of every 10 adults in America are overweight or obese. We just talked about how 88% of Americans have some degree of insulin resistance. And in 2023, the American Diabetes Association essentially lowered their standard. And they said normal A1C for adults 65 and over with no kind of chronic health conditions and no cognitive impairment should be less than 7 to 7.5. Well, the diabetes cutoff is 6.5. So they're essentially saying type 2 diabetes is the new standard of care. Expect your older adults to have diabetes, and we don't need to necessarily treat it. So this just gets me fired up because there's so many adults in this gray zone of healthcare, and you work with them. It's like men just don't feel that like themselves anymore. They want to feel better. Their doctor's not giving them specific enough advice. That's why what we do is so important, to help empower people and educate them to take responsibility and accountability for their own health.
I am so flabbergasted at the fact that even in the insulin world, we are lowering the standard, because in the testosterone world, the exact same thing is happening. Back in the 80s, normal testosterone levels was the low would have been 500 nanograms per deciliter, maybe even 600, and the high would have been about 1,500 nanograms per deciliter. Now, the normal range is 200 to 800 or 900. But we all know that like anything under 400 nanograms per deciliter with testosterone, I mean, you've got lots and lots and lots of problems. And so, again, we continue to lower all the health markers continue to get lowered, which is startling to me, seeing that we have so much advancement in medicine, in technology, in our knowledge. That why would we be pushing everything back?
Like I said, I think we're getting so desensitized. Like if you go to, I don't know, I just remember growing up, it was a little bit more uncommon to see somebody very overweight.
Totally.
And now it's far more uncommon to see somebody at a healthy weight.
Totally.
And it's just, I think that another example of this is portion sizes.
Yeah.
Like if you Google like portion sizes 1950s versus today, you're going to see like how much the Big Mac and the fries and the pop has changed. Is startling.
Right.
But when we are becoming desensitized by our culture, it's very easy to follow suit. And these labs and I think big associations are essentially looking at the normative data to determine those cutoffs and those numbers. But we don't want to be normal. We want to be optimal. And so I think that's why having these conversations that are a little bit more nuanced are really important.
So what are some of the lifestyle contributors to insulin resistance, type prediabetes, and type 2? Let's talk about that. What are some of the things that people are doing in order to end up there?
Oh man. Okay. So I like to say there's 4 pillars. There's nutrition, there's stress, there's sleep, there's physical activity. And those pillars are built on a foundation of a strong mindset. And I work with a lot of women, and I would say a little bit more tender-hearted men, where that emotional side is very important to them. And it often derails their progress. They struggle with consistency. And so we have to really have that strong mindset. But let's just start with nutrition. I don't know about your community, but it seems like around here, a lot of guys like drinking beer. I live in Nebraska. Okay. And so excessive alcohol use, really, alcohol is a toxin to your body. It's completely unnecessary. So I think that one is pretty well agreed upon, that like alcohol is toxic to your liver. Your liver gets insulin resistant too. We need to probably remove that. Excess sugar. So pop is a huge factor. Just to put this into reference, it's really interesting. There's only a teaspoon of glucose in your 5 liters of blood at a time. 1 teaspoon, that's 4 grams. That's kind of your body's happy set point. 1 Pepsi has 41 grams of sugar. So half of that is glucose, half of that is fructose. We don't need to get in the nitty gritty, but you're essentially putting 10 times the amount of sugar that's naturally in your body into the body that your body has to what am I going to do with you? That is spiking your glucose, spiking your insulin. So we really want to think about things that are spiking our glucose. So refined sugars, refined carbohydrates, so things like bread, like any pasta. A lot of people are like, well, what about whole grain? Like any grains, even if they're whole, they're very high in starches, which is just a sugar, right? So starch is just many molecules of glucose bound together. Once it's in your body, your body does not know the difference between a starch or a sugar or honey or agave. It's all sugar. Glucose and fructose is different again, but we're not going to get into the nitty gritty here. So refined starches, refined sugars, like cereals, all that stuff, pop, we really, really want to be reducing in the diet. The other thing would be, unfortunately, whole foods. Like I think that the whole foods plant-based diet is like having this revival right now. However, there are some whole food, plant-based items that are still high in starches, still high in sugars. And so we want to be moderate about that consumption. The more insulin resistant you are, the lower your carbohydrate tolerance. So the more advanced your type 2 diabetes, the lower carbohydrate level you're going to need, the more intermittent fasting level you're going to need to reverse it. People who have a lot of muscle mass can tolerate more carbohydrates because they have more, like I always say, I like to say the muscle is like the garage and the glucose is the cars. So the more muscle you have, the bigger garage you have, and the more cars you can fit in there.
Triple door garage, baby. Triple door garage.
Triple door garage. Yes. And so I think that that's important to recognize that when I say low carb, I don't want to scare people away from carbohydrates. It really is person specific. And we can talk about how do you determine your own carbohydrate threshold. That might be helpful follow up. Yeah. Now, the next thing would be low protein. So I recommend 1 gram of protein per pound of ideal body weight. Mm-hmm. If men are like, well, what's my ideal body weight? I'm not sure how you recommend it, but I usually say for every for the first 5 feet, do 106 pounds. And then for every inch over 5 feet, about 6 pounds. So whatever that ends up to be for you, that's a rough estimate. We need to prioritize protein so you don't have a bunch of carb and sugar cravings. You have to be satiated. And then lastly, we want to really prioritize healthy fats because fats have the lowest blood sugar or the lowest glucose response. So those, whatever people's dietary preferences are, but avocados, olives, nuts and seeds, fatty fish, all of those are great to include in our diet. So from nutrition, again, prioritize foods that are high in protein, high in healthy fats, high in fiber, low in starches and sugars, especially refined starches and added sugars. So the next conversation is our eating window. I think that there was a lot of messaging in the 90s and early thousands about, eat 6 times a day to keep your metabolism up or eat a bunch of mini meals. And the issue with that is you're constantly stimulating your blood glucose and your insulin, and you're not really allowing that digestive system to work and your levels to come back down below baseline. So I typically recommend structure those meals at least 30 grams of high quality protein per meal, spaced throughout the day. And let's kind of cut the late night snacking, the middle of the night snacking. That's a nice place to start for fasting. Again, the more insulin resistant somebody is, the more they may need to fast. So before I move on to the other pillars, any nutrition related questions?
No, this is great because my philosophy in nutrition, I wrote a book about it, for men over 40 is about 3 meals a day, no more, no less. Balanced plate meals because of that exact thing you just said of spiking insulin when we're doing this grazing from 1976. Yep. It's not 1976 anymore. We have learned more. There's a lot more science and research that shows that this is going to cause more insulin spikes and to cause you to become more insulin resistant. So it's 3 meals a day. Each meal has to be balanced. So we have a source of healthy fats because that also has cholesterol. Cholesterol is needed for testosterone production. So good, high quality, healthy fats, like you said, avocados, like one of the keys that we use. Protein, because again, it's the building blocks. But you'll be so surprised how men 100% do not get enough protein. In fact, we had a challenge at the beginning of the year. I wanted guys to get at least 150 grams of protein per day. Like that was extremely difficult for a lot of these guys because they don't even realize how much protein that is. And for the regular person who's not, even these guys who are training, but for the regular people who aren't really training or been sitting on the couch, they'll have no clue about. Some people don't even know what protein is. Guys know what protein is, let alone how much. So again, protein being key, complex starchy carbs. So the good carbs, because we do need those carbs for our metabolism, for the thyroid, for insulin sensitivity, specifically if you have good carbs. And again, when you add the proteins, the healthy fats, and vegetables and fruits around that, you're going to have 3 balanced meals. But again, that for us, it's metabolism, hormone balance, health, of course, and just energy levels. So that's really what you're saying is pretty much right on point with how I teach our the nutrition and yeah, I think that's fantastic. So I don't know if there's any. I mean, Oh, the other thing is about pop. I want to ask you, or soda. I want to ask you a question about diet soda and 0 calories and like all of these. No, have this 0 calorie or diet. This is going to be the one. Talk to me about that, please. Talk to us.
Okay, so there are some sweeteners that have been proven to be healthier than others thus far. The 2 that I try to stick with would be stevia and monk fruit. They're a more natural option. I do use allulose for baking. I personally do not like erythritol because it has so many GI effects for me personally. There's not evidence to show that it raises glucose, that it raises insulin, that it affects gut health, but I really try to reduce any of that erythritol. So unfortunately, a lot of the sugar-free stuff is out for me, and I typically just use the stevia drops, and if I'm baking, I'll use like a monk fruit allulose blend. But the ones you really want to look out for would be the acesulfame potassium, the asparane, the saccharin, the sucralose, and the maltodextrin.
Thank you.
Yes. So those, maltodextrin is interesting. That's like what they put in sugar-free Jell-O.
Right.
It's also an ingredient in my deodorant, which I think is interesting. It's like a thickener agent for food.
Right. Yeah.
And it is not good for blood sugar levels. So I challenge somebody who's wearing a continuous glucose monitor, check your glucose, eat a bunch of sugar-free Jell-O, watch your glucose rise. Maltodextrin is a quote-unquote sugar-free food that still raises blood sugar. Now, the issue with the other artificial sweeteners that I mentioned is they really impact gut health, and they contribute to inflammation in the gut and then leaky gut, where bacteria that are in your gut escape essentially and travel throughout your body and cause systemic inflammation. We know inflammation drives insulin resistance. So I highly, highly encourage people look at the food labels. And this is a simple trick. Like I evaluated a patient once in home care. I'll never forget it. And he was wheelchair bound. He'd had several amputations of his foot, toe from diabetes, but he had no diabetes medications on his record. And I was like, what? So I went in and I did his evaluation and I'm like, all right, dude, you have these amputations. Where's your diabetes meds? And he was like, I don't take them anymore. And I was like, oh my gosh, are you okay? Do we need to call the squad? And he was like, no, I didn't want them to amputate my other foot. I wanted to be able to still stand and transfer myself. And so I just cleaned up my diet immediately. And so even him, who had very advanced type 2 diabetes, was able to reverse the condition. And I said, that's so great. Like, let's now take it to the next level. So I went into his kitchen and he was having loads and loads of artificial sweetener, like the packets that he would put in his water. And so I said, let's optimize that next, so it's a good, better, best. And the drinks that I typically recommend are Poppy. So Poppy still has 5 grams of sugar, but it's better than a regular pop. So if you're going to choose a pop, choose Poppy. The Zevias, my husband really likes. And then I try to stick with the LaCroix or the bubblies, like the naturally essenced waters.
Sure.
I just personally grew up having dessert every night. And so I have such a sweet tooth propensity that even if I have stevia or monk fruit, like I know I'm probably going to increase my sugar cravings throughout the day just because of that. So it's person specific, but there's always a healthier option out there. I just really encourage people to not have those artificial sweeteners because of their gut health. But the other thing that's super interesting are the lecithins. I think I'm pronouncing that right. It's like LEC. ITHANS or something like that.
Yeah.
And you're going to see a lot of like soy lecithin in low sugar products, especially bars. That's also something that will cause gut inflammation.
Totally.
So one of my favorite protein bars used to be the Kirkland brand. Again, good, better, best. But yeah, they definitely have the soy lecithin. So that's another food additive that can contribute to poor gut health and then insulin resistance in the long term. So look out for that additive too.
It's so funny how all of these, because again, no pop, zero protein bars, because they all have those secret ingredients. You know, I'm in the supplement world, so I know what people put into supplements. I know what we have to keep off, and that's why my supplements are all we have to create it from scratch, just because even a white label supplement may have something that we don't want. But it's so incredible how all the things that you described are all the things, like when I have a gut health doctor on, he'll describe that. When I have a metabolic health doctor on, they'll describe testosterone. I describe. So again, this is so important to why getting rid of all of those foods until you get to a healthy state. Like I say, listen, just do it until you get to a healthy state. But then you're going to understand that when you add that back in at some point, your body's going to reject it. You're going to feel horrible, and you'll be like, okay, this is not for me. But specifically those pops and the protein shakes as well, because my wife, who is Miss Healthy 2023, because we're at 2024 at the moment, and things are a little bit different, but she started using these protein drinks. And I'm like, why are you using protein drinks? I have a protein powder. It's like, oh no, this is a healthy protein drink, and this doesn't have sugar. And so I'm like, there's no such thing as a healthy protein drink. Like there's nothing. So I looked and I saw the sucralose. I'm like, this is what's causing your gut health, what's causing probably you're working so hard in the gym, you're working so hard with your workouts and your nutrition, but there's one thing that's kind of holding you back. What is that thing that's holding you back? It's not menopause specifically. Could be just this that you're having every single night, right? Because they hide that in there. So that's why you have to be very, very careful, I believe, with all of these drinks or pops, as you say, or 0 calorie, however they try to market, because there's always something in there that's hidden. What do you think about that?
Yeah, I think that's true. I think whole food is always better. I have protein shakes. I am very specific about what is in my protein powder, but I also recognize that there's the sweeteners too. Like there's stevia or monk fruit. I'm probably not going to be as satisfied from that protein drink as if I had real food.
Right.
So I think that real food is always best, but we have to be intentional about how we're structuring those whole food meals, just like you said.
Totally. So let's talk about sleep and physical activity as the other reasons why people can be insulin resistant.
Yeah, and stress. I think that men in general mask stress a lot. By the financial pressure, the pressure to just kind of like be, that alpha male that you talk about. It's like sometimes that's hard for men to sustain. So the stress, I think, is important. So when your body is in a stressful state, the fight or flight response, cortisol is released. And that stimulates blood sugar to be released into your bloodstream, because if you're going to fight or flee, you need that energy for your muscles available so that you can punch or run or do whatever you need to do. But if that stress is more emotional or financial, well, your muscles are not utilizing that. You're sitting at your desk or doing whatever, and which is why exercise is very important. So what happens is insulin is released to push that blood sugar back. So we really want to be mindful about our stress management principles. This is probably a whole nother show, but stress will contribute to insulin resistance. Sleep deprivation will as well. So chronic sleep deprivation, which is defined as getting less than 7 hours of sleep a night, on a regular basis, that's a form of stress on your body. I'm sure you've talked before about human growth hormone spikes when you're sleeping. So that's a super important time for muscle building and recovery. And so when we are sleep deprived, there's some definite hormonal effects, and with stress in general. So this chemical, the substance called NPY is released, and that makes you selectively crave carbohydrates. So that's why after a night of poor sleep, you're going to want to crave more food, you crave more carbohydrates. A couple other changes that happens with poor sleep is your appetite is increased and your satiety is decreased. It's so much more common and likely that you're going to overeat after a night of bad sleep. I experience this like every time. I'm reminded every time I have poor sleep. And so I think it's important to be proactive with your sleep strategies. And I don't know about you, but it's like some of my biggest tips are blue light blockers. Have you recommended like those before?
For sure. Yeah, definitely.
Yep, the amber colored ones. They have to be the amber colored ones to block the blue light. What that does is it lowers, like when blue light comes into your eyes, like right now I have a ton of blue light.
Yeah,
I have 2 box lights, my computer light, there's light everywhere. That's okay because it's daytime. That raises your cortisol level to keep you alert. So a little bit to keep you alert. But cortisol and melatonin, your sleepy hormone, are on a teeter-totter with each other. So if your cortisol is up, your melatonin cannot come up. That's why if you have a fight with your spouse and you're super stressed out and worked up, you're not going to fall asleep. Cortisol is too high, melatonin cannot come up. So we block the blue light to let the melatonin come down, or the cortisol come down, melatonin come up naturally. So that's my biggest sleep tip, but also just cleaning up your diet, like avoiding refined sugars, avoiding alcohol. That's going to help a ton. Whenever my husband has a bad night of sleep, it's because he had beer and sugar. I feel like is the main thing, and he's pretty healthy overall. But those are 2 tips. And then, so stress, sleep, physical activity. I always say like strength training should be the cornerstone of any physical activity program. Again, I work with a lot of postmenopausal women who think cardio is king because they're burning calories. And like, yes, calories matter. Even low insulin calories matter when it comes to weight loss. But it's like we have to focus on resistance training because the effects of resistance training, the metabolic effects of resistance training can last like over a day after that single workout. And so, yeah, you burn fewer calories in the moment, but your metabolic rate stays up throughout the day and you're actually like rebuilding tissue in your body, whereas you don't really get that with cardio. So I think a balance is nice. Cardio is nice for stress relief or if they have specific fitness goals. Intense exercise can be great for blood sugar regulation and management too, like little bouts of high intensity exercise. But primarily, I really like people strength training. So I'm kind of curious on your exercise. I'm sure you've talked about it before. Recommendations for strength training, because I have my own, but what are your general recommendations for that?
So I'm a master metabolic conditioning coach. I have a certification that I created in metabolic training. So it's metabolic training that we use. So metabolic training would be moving from one exercise to another with little to no rest in between. So 40 seconds of work, 20 seconds rest. But it's metabolic resistance training. So dumbbells are huge for us because you can train with dumbbells at home or at the gym or what have you. So that's exactly what it is. About 20 to 30 minutes. Just like you said, you may not be burning a ton of calories during, but metabolic training has the epoch or afterburn effect where you're going to continue to burn calories over and over again. Muscle building is huge for us because we suffer from sarcopenia, natural loss of muscle due to aging. So along with the fact that if you're not building muscle, it's going to affect your metabolic stress, your metabolic health, but also you're going to gain more fat, right? Because you're not as metabolic. And so, basically that's what it is. It's 20 to 30 minutes, depending on what the workout is. Sometimes it's body weight so that they can master the movement, but most of the time it's with dumbbells. It's either functional, so movement based, or we're hitting body parts. And I have 3-4 years of training inside my brotherhood, inside my membership site. So and that's why I say I'm a master metabolic trainer, because I have so much programming. And whether it's dumbbells or kettlebells, but you need a little bit more technique and skills to learn how to use a kettlebell, or resistance bands, which I'm actually creating a program right now for resistance band training. That is the perfect, the before and afters, the transformations, and not just their body, but overall health is night and day, specifically because most guys don't think that a short workout like that can garner so much, results. Yeah. But it's unbelievable the results that they get, and spending so much time in the gym also increase your cortisol levels to a chronic state. So that's generally what we use for sure.
And how many times a week do you do those 20 to 30-minute workouts?
3 to 4 times a week. That's it. Because the other 2 days are recovery based. So mobility, flexibility, range of motion, yoga, they have to do that. And in fact, because we're getting older, it's less about getting the six-pack abs and getting shredded, specifically when you're in your 60s and 70s, because we have a lot of guys in their 60s and 70s. And although they do want the six-pack abs, not when they're coming in. Most of the guys who come in, 99.9% of the guys who come into my program are like at rock bottom. So type 2 diabetes, we've reversed a lot of type 2 diabetics, pre-diabetics, all this medical health, medical and chronic health issues. So I'm so happy that you're here today. But it's for longevity, right? Because when you're in your 60s and 70s, you're going to be retired or getting into the retirement age, and now you want to be able to run around with your grandchildren, or keep up with your kids, or go when you're traveling, instead of just going to the big cities and doing what everyone else does, you want to go hiking, you want to enjoy, and you want to do that healthy without pain. So the recovery piece is important, and 3 to 4 main workouts are key, and then that 1 day of rest.
Yeah, I really like that programming. I think just from my own experience too, I just wrapped up a half marathon in May.
Whoa,
and I didn't train as hard as I probably should have for that. I decided to we live in a 100-year-old farmhouse. And so I was doing really well with my training. And then in February, I was like, I want to do these floors. And so I had just stripped everything. I completely redid our hardwood floors. You can see them in the background.
Yeah, I like them.
And I kind of just let it go. But I enjoyed it, but I really feel better with more moderate strength training than I do with hours and hours and hours of cardio. So I have used a similar training protocol as well. I've experimented with that metabolic training, like the 40 on, 20 off. That's a hard thing. And I think that's the intent, that intensity is so important. And that's actually really good for blood sugar. And I think a lot of people overlook the fact that you can get a cardio workout while you're strength training.
Totally.
It's like that dual effect. So I really enjoy those types of workouts too.
That's awesome. Okay, we only have 15 minutes, so you have to come back 100%.
Oh, sure.
But I have 2 things to ask you about. Number one is this cholesterol. So there's this whole thing about, actually it's 3 things. There's a whole thing about cholesterol, right? For me, and for what I talk about to men, cholesterol's huge. The LDL versus the HDL, super, super important. But doctors are still old school, and when they see cholesterol, they're like, oh, you got high cholesterol. Like for me, I just came back from the doctors. I got all my blood work, and he's telling me, oh yeah, your LDL are great. They're high. It's awesome. But your HDL is a little bit high. And I'm like, so we want to look at that. Maybe we'll put you on something. And I'm like, whoa, hold on a minute. First of all, we need cholesterol for testosterone. And so he was just like, okay. And then I said, and that HDL could be high for a bunch of reasons. Maybe it was just something that I had eaten or something. It's not, and it was just a little bit high, right? It wasn't something that was huge, but right away it was prescribe. So talk to us about cholesterol. What are your thoughts on that?
Well, I think we have to recognize first off, if people are really interested in this, there's 2 resources that I would encourage them to go check out. The first is the book Metabolic by Dr. Robert Lustig. And then if they prefer this format, if you Google Casey Means Robert Lustig cholesterol interview, it'll pull up, and it's a really good interview of him explaining how to properly interpret your cholesterol panel. So I'll give a little bit of an overview, but if people want to check it out more, those are 2 good resources. So when you're getting a lipid panel, they're looking at your total cholesterol, your LDL cholesterol, which is historically the bad cholesterol, your HDL cholesterol, which is historically the good cholesterol. They're looking at your triglycerides, and then there's probably a glucose and an A1C as well. And so according to a lot of the experts, that means nothing. So total cholesterol and LDL cholesterol specifically mean nothing. LDL cholesterol is a calculated amount of cholesterol within your LDL particles. So triglycerides mean something. Yes, we're excluding that. We're talking total cholesterol, LDL cholesterol. What are we looking at? We're looking at the cholesterol inside of the lipoproteins carrying the cholesterol. So I want you to think about the LDL, low density lipoprotein. That's what that stands for. And then HDL is high density lipoprotein. But what they don't put on that paper is it's actually LDL-C, HDL-C. And they're talking about the calculated cholesterol within the particles. So think of the particles like a ship on the ocean or on the river. The ship has different cargo. It might be carrying cholesterol. It might be carrying triglycerides. So it might be carrying protein, right? So with the particles, not the cholesterol within the particles, are actually what is really the most important thing for determining cardiovascular risk. So physicians have wrongly been prescribing statins based solely on a high total cholesterol or a high LDL cholesterol. Because yes, statins will bring that cholesterol number down, but that's not always beneficial. We want to bring the particle number down. The number of ships circulating, that's what we want to bring down, not necessarily the cargo. So how do we do that? Like a standard lipid panel will not give you that information. So if you have high total cholesterol, if you have high LDL cholesterol, which will happen on an animal-based diet. So if you're eating more saturated fat, that will raise your LDL cholesterol, okay? Or on the blood work, it will, which is probably, it could be okay, but here's how we dig a little deeper. Get the NMR lipoprofile test. So I maybe like lifeextension.com, but if you just Google NMR lipoprofile test, that's going to give you that information of how many particle numbers do I have, and also what are the size of my particles. So we don't really care about the cholesterol. We care about the particles, the ships swimming through the bloodstream. And there's differing opinions here. Some experts think that it's the number of particles, period, that matter. Some experts think it's the size of the particles. I think it's probably a combination. Yep, so a lot of people may be familiar with small, dense LDL particles. And compare that to large, buoyant LDL particles. So what that NMR test will show you is how many large do I have? How many small do I have? And in his book, Why We Get Sick, Dr. Ben Bickman does a really nice job explaining how those large ones are like a beach ball and the small ones are like a golf ball on the inside of our blood vessels. Which one do you think is going to be more inflammatory? Definitely the golf ball, right? It's a small, yeah. More aggressive, more inflammatory.
Right.
So that's an important conversation that if you are taking a statin or if you're threatened that you need a statin, get that NMR test. But the other one that I would recommend is the LP(a) test. So capital L, lowercase p, parenthesis a, LP(a). That's a genetic risk factor for cardiovascular disease that essentially increases the likelihood of clotting. And that's something that, to our best knowledge, does not change with lifestyle interventions. And so according to Dr. Peter Attia, in his book Outlive, which is really good, very dense, but very good, he said that people with LP(a), that risk-benefit ratio of taking a statin may lean towards taking it. Just to keep those particle numbers as low as possible. So I think it's very personalized, but I would never encourage somebody to accept a statin before you do your due diligence, figure out your particle number, the particle size, and your LP(a). Your physician may have no idea what you're talking about. That's okay. And then you can make, just like you did, like you can have an intelligent conversation, hopefully with your physician, about the risk-benefit ratio, because the thing is that statins do increase insulin resistance. There is a risk for taking statins. And I'm sure you know too that common side effects of statins are like hair loss, cognitive fatigue, or like brain fog, cognitive changes, and muscle pain and muscle weakness. My dad had those symptoms on a statin. So statins are not a benign medication. We have to weigh the risk-benefit ratio. Another common medication that your audience may be taking would be like metoprolol or any beta blocker for blood pressure. That also contributes to insulin resistance, which is crazy because it's like, well, the insulin resistance probably caused the blood pressure. Now we're taking a medication to make the underlying problem that caused the problem worse. So I think that we have to be careful and recognize that whatever we're putting in our body contributes to that baseline level of insulin sensitivity. So we want to be cautious and use good judgment whenever we're taking a medication or eating a food or taking a supplement or anything like that.
Yeah, totally. Thank you so much for explaining that, because I think I may have said this wrong, but it was my good cholesterol that was high. And
I
then
thought
yeah,
that,
that's what it was. Yeah, the good cholesterol was high. The LDL was a little bit high as well, but that was probably because I do eat a lot of meat. I eat meat,
that's
to get the good cholesterol. So, yeah, and then I was going to ask you about meat,
fine.
eating meat, because that's now become this thing that, I mean, it has its times, right? Like now, again, it's like, oh, don't eat meat, don't eat the dietary fats. It's bad for you, what have you. Yeah, and then it goes away, and now it's back with a vengeance, and we stay away from vegan and vegetarian just because, again, it affects your hormone levels, right? That's for us, it's
It
the
does.
hormones, and so do statins and all of the prescription drugs as well. But talk to us about why we should be eating meat and dietary fats, and
Yeah,
why we
well, first off, they're essential nutrients. There's essential proteins, there's essential fatty acids that you can only get from animal products. And vitamin B12 is not really found in plant products. So if you're vegan or vegetarian, I strongly consider you to think about incorporating some animal products, or at least like a branched chain amino acid and vitamin B12 supplement. There's probably more supplements that you need. But, meat is the most, like eggs, red meat, they're the most nutrient dense foods that we can eat. So if we can try to find products that are humanely raised and clean, that's what we need to be eating. I mean, look at the two of us. Meat is the number one ingredient in my diet. Number one, and we have good health. But I think that there's so much messaging about this plant-based diet. And what people don't realize is the food matrix really matters. So the proteins, the amino acids found, let's say, in quinoa or in another plant-based source like beans, that comes packaged together with certain anti-nutrients that reduce the absorption and digestibility of the protein that's found in that food. The other thing is a lot of plant-based proteins are not complete. And if they are, it's in like such minuscule amounts. And it comes with carbohydrates, right? So if we're talking about insulin resistance, you can get a little bit of protein with a lot of carbohydrates, or you can get a lot of protein with a little bit of carbohydrates. That's definitely going to be better for your blood sugar and your insulin. So if people are interested in that topic, like the anti-nutrient topic, again, I eat plants. I don't really exclude anything from my diet. That doesn't work for me mentally. However, I love learning about what's in my food so that I can make more informed choices. And a really, really good book is Change Your Diet, Change Your Mind by Dr. Georgia Ede. I had her on my podcast. She was so intelligent. I loved her to pieces. And her book does the best job that I've heard of so far, explaining why we need meat. She's a psychiatrist. And so her focus is central insulin resistance in the brain. And, as blood sugar rises, whatever is good for your blood sugar is good for your brain sugar, she likes to say. So she talks about meat, but then she also does such a good job breaking down a lot of the plant-based myths, getting into the anti-nutrients, getting into how does eating plants differ from eating animal products, and why do we need to focus on eating more animal products for our mental health, for our cognitive function. So I loved that book. If people are interested in learning more about that topic, I would suggest that resource.
This is amazing. And you know what? We're running out of time, and there's so much more we need to discuss. So you are going to definitely come back.
Awesome. Yeah.
But, you did mention some of the ways to reverse this, which we talked about when we talked about things that cause it, right? Like literally the total opposite of what we talked about. But just if you can, 1 minute, 1.5 minute, go over the ways to reverse, insulin resistance, type 2 diabetes and prediabetes.
Okay. So number one, like I completely agree with you. It depends on where they're starting, but I'm going to assume they're starting with a pretty unhealthy lifestyle. So number one, 3 square meals a day with at least 30 grams of animal-based protein per meal. So that's like 5 ounces of meat or like 5 eggs. Or if you don't want that much fat in your diet, you could do 4 eggs with half a cup of egg whites, something like that. That's number 1. 3 square meals, at least 30 grams of protein per meal. Number 2, sleep 7 to 8 hours a night. Number 3, strength train at least 3 days a week. It depends on your programming. And then number 4 is watch the total carb, like the net carbohydrates. So the net carbs are total carbs minus the fiber. I didn't get into fiber today. So I would really recommend starting at about 80 to 90 grams of net carbohydrates per day, spaced throughout the day. So like 30 grams a meal, and see where that takes you. We didn't get into the CGM stuff today, but that's how we can determine your personal carbohydrate threshold. And if that's not getting you the results that you want, then I would suggest lowering the carbohydrates even a little bit more.
Okay. Stress?
Yep.
Handling stress. Okay. We're going to add that there too. Handling your stress.
Yes.
Okay. It's amazing. Okay. Where can people find you? Because you did mention about a test, a home test that you have. What is the home test you have and where can we find it? And then also where else can people find you?
Yeah, of course. So our website is zivli.com, Zivli.com. And what that means is to live a low insulin and low inflammation lifestyle. So it's a weird name, but it does mean something. Good. And on there, they can see the testing options just at the top. Click testing, purchase an at-home insulin test. We have an online program that we run. It's 12 weeks long to learn how to live this type of lifestyle. It's excellent for somebody interested in what we talked about today. And then I have a podcast as well, Reshape Your Health. I'm on YouTube at Dr. Morgan Nolte, and then Instagram at Dr. Morgan Nolte too.
This is amazing. Dr. Morgan Nolte, thank you so much for being on this podcast today.
Great.
100% you're coming back. And yes, I cannot wait to get this out. Guys, definitely go to Zivli, Zivli.com right now and get that home test so you know exactly where you stand so that we know whether what you're doing is phenomenal and keep doing it, or you need to make changes, and we need to make changes rapidly because you do not want to be like my aunt-in-law. Aunt-in-law, is there such even thing? That got her leg chopped off because she had type 2 diabetes and then ended up dying from type 2 diabetes, and she was not very old. So get on this right now. Thank you so much for being with us, and we'll see you on the other side.
Thanks, Funk. I appreciate the time today.